Okay, we're all set. Thank you, Brittany. Welcome.
Perfect. Hi, everybody. Like Lisa said, my name is Dr. Brittany Korman. You guys can all call me Brittany. And I'm a doctor of physical therapy. And then I'm also a personal trainer and group fitness instructor. So I kind of take this approach in discussing exercise, especially throughout your cancer journey, from the perspective of as a physical therapist and then also as a trainer. Um, if you guys are willing and feel comfortable, feel free to send a message in the chat and kind of let me know where you are in your journey. So, if you have started chemo and you're currently going through treatment, if you have finished chemo and you're dealing with the after effects of chemo, or if you're prepping prior to treatments or you just got a diagnosis. That way I can kind of tailor any discussion later that we have towards that. But I'm going to kind of talk to you guys today first about why exercise is important throughout your journey, what types of exercise to incorporate, how to incorporate those exercises into your week, and the things that you need to figure out kind of how to manage with fatigue and time of exercise, type of exercise, and then any other questions that you guys might have for me. I also have our friend and client patient, Nikki, who is going to chime in for a little bit after I get started, just to kind of share her experience and tell you guys how exercise has benefited her journey and her recovery, and kind of give you guys an insight into how this is from real life perspective. So okay, perfect. Thank you. Thank you, Becky. Um, so why are we here? That's first and foremost. Why is exercise important during and after cancer treatments? So one of the biggest complaints, whether you're going through chemo or just dealing with being diagnosed and after, is fatigue. And so there is no medication that we can take that's just going to help get rid of the fatigue. And the hard part is that when you deal with that level of fatigue, you're less motivated to exercise. The biggest thing that I'm going to teach you today is that exercise and movement is going to be the best medicine for handling fatigue. Now, I'm going to give you some strategies on how to manage that, but in general, exercise is going to be your best friend when it comes to handling fatigue during and after treatments. The other biggest thing is in your functional strength. So, whether you're in treatment, you need to get up and out of a chair in order to get in and out of a doctor's office, get up and down in your house, going up and down stairs, you need to be strong. During treatments, you're going to deal with a lot of atrophy, which is loss of muscle mass, just because you're not able to do everything that you're normally doing. Some surgeries can also cause atrophy or loss of muscle mass, whether that's an abdominal surgery, breast surgery, anything like that. And just having a hospital stay can lead to atrophy. So it's super important. And especially because I think my whole audience today is women, which I love, dealing with the side effects of chemo or radiation or treatment, in addition to maybe changes in hormones, depending on where you are in your life cycle, whether that's perimenopausal or you're going through menopause as well, those things can all affect your muscle mass. So it is super important to do resistance training exercises to the level that you can tolerate. The other important thing is going to be about working on your balance. So there's a couple things that can affect your balance during treatment. Number one will be chemo-induced neuropathy. So you might be dealing with symptoms of numbness, tingling in your feet, especially. And unfortunately, there's not a lot of great treatments for it. This is probably one of the biggest complaints that I get as a physical therapist. And when I was teaching at the Cancer Wellness Center, like, how do we manage neuropathy? Unfortunately, with nerves, they take a while to heal. So it can improve over time depending on the amount of damage. But in order to mitigate the effects of neuropathy, it's super important to work on your balance. And in a little bit, I'm going to give you guys a couple tests to do to test your balance. I decide to see what you can focus on with that. The other important things that can help, the exercise can help with, are managing the depression and anxiety. So there's a lot that comes with a diagnosis and the treatment, anything like that. So exercise can be super beneficial for increasing your endorphins, helping with mood, helping with regulation of hormones. So it can really help with managing depression, anxiety, and everything that goes along with it. There's also added benefits of, joining a group, maybe that's doing some of the virtual classes that Cancer Wellness Center has to offer, and or finding like a walking partner, a walking buddy, but using exercise as a way to interact socially in a setting that you feel comfortable with can also help you manage these tough times. And the last thing, or last two things that I want to touch on, is it helping with weight and with pain. So obviously there's a lot of changes to your body, whether that's medication related or treatment related. And so it can be very difficult as you're going through your treatment process to manage your weight. Obviously, a huge component of that is going to be your diet, which I'm not going to touch on today, but we can talk about in future sessions. But exercise can be a great way to manage your weight. And lastly, it can help with pain. So I like to tell all my patients that motion is lotion. And a lot of the pain that you have contributing from chemo can just be generalized pain. You might wake up one day and like your back is aching or your ankle is aching, and you're like, there's really no rhyme or reason. And unfortunately, that can just be side effects of chemo. So general full body exercises and movements can really help reduce your overall pain. So those are the kind of whys of why we're here, why we're talking about exercise and all the benefits that it can have for you during and after treatments. Now, I know that like there's a lot of stress on, okay, you need to exercise, this is going to help you, this is why, but then it's pretty daunting of like, how am I going to actually incorporate this into my schedule, into my life? I know that a lot of your schedules are probably currently limited by, the stress of figuring out when the treatments can be done. You're doing a lot of doctor's appointments. Maybe you're taking care of family as well and kids. So I understand that your schedules are busy. The biggest recommendation that I can give for you guys today is schedule exercise into your week. I know that you guys all have a lot of medical, treatments and appointments, and I guarantee that you never miss those appointments unless something is really bad. So I want you to treat your exercise in your week like it's a medical appointment. And what I recommend doing is on Sundays, looking at your schedule for the week, and then, find the times that you can fit in, even if that's a 30-minute walk or your resistance training and anything like that. So, and understanding that, like, so for example, I have a patient right now that is going through chemo, and his fourth week, he feels the best. So he's seeing me every 4 weeks because his week off is when he feels the strongest and he feels the best to work with me. So understanding that it's going to be ups and downs. And so on the weeks where you know that you're typically having more energy during your treatments, you can schedule more exercise into your week on those days. On the weeks where you're dealing with treatment or you have a busy schedule, find the little pockets where you can just do little tidbits of exercise throughout those days. And I'm going to be more specific shortly on kind of goals for exercise, but I really want you guys to focus on figuring out how to schedule exercise into your week and where you can make that most attainable based on the examples that I'm going to give you here shortly. So the things that I your main exercise goals, and again, I'm going to send this out in a handout afterwards, but you guys feel free to kind of write some things down. So your overall goal is going to be 150 minutes of moderate exercise per week or 75 minutes of vigorous exercise per week. So those are going to be your cardiovascular exercise goals. Now, that 150 minutes can be broken up into any amount of different intervals of as low as 10 to 15 minutes at a time. So you could do the basic of 30 minutes, 5 days a week. And I know everyone's probably wondering, okay, what does moderate exercise mean? I like to use the talk test. So that's about walking at a fast pace where you and your friend can still have a conversation, but you're not totally breathless. Vigorous exercise is going to be kind of a step above that, where you can talk, like have a conversation, but you can't sing. You're starting to lose your breath there. And that would be more so like being on the elliptical at higher incline, walking on a higher incline, maybe doing the Peloton or swimming, and those types of things. Now, one caveat that I didn't mention is obviously always talk to your doctor first about any restrictions that you might have. That could be like having a port and not being able to lift more than 10 pounds. That could be certain heart rate variabilities that your doctor feels comfortable with. So if they tell you, you're allowed to do cardiovascular exercise, but you need to keep your heart rate below 150 beats per minute, then I recommend wearing an Apple Watch or a Fitbit that gives you your heart rates. So that's your overarching goal. And again, that can be broken up. So if you're going through treatment and you can only tolerate walking for 10 minutes at a time, that's totally fine. Break that 10 minutes up and incorporate it maybe at 3 different points in the day. So you can do a 10-minute walk in the morning, a 10-minute walk after lunch, and a 10-minute walk after dinner to hit your 30 minutes for that day. I call those, like Lisa loves this, what I call this movement snacks. So you can break that up throughout the day. Different options, like I was saying, can be walking, jogging or running if your body is capable of that, which I don't always recommend if you're not feeling up for that. Biking is a great low impact option. That can be outdoor biking or on a Peloton or stationary bike. And then swimming is also another great low impact way, as long as you don't have a port and as long as you don't have anything that prevents you from doing anything in the water. So again, 150 minutes of exercise or 75 minutes of more higher intensity. And that would be more like your boxing classes or your HIIT classes, if your body is capable of doing that. Again, these are goals to build up to. So start small. If you are only able to walk for 10 minutes at a time right now, that's a great starting point. Each week, try to add a couple minutes to that until you can build up to that 30-minute walk. So find your starting point, get a good baseline for where you're at, and then gradually increase that level. I compare exercise like that to taking a drug. So a lot of you are taking different medications. You can't start at a high dose and expect your body to respond well. You usually have to titrate that up. So find your baseline of cardio exercise and then gradually build that up from there. Does anybody have any questions on cardiovascular exercise and timing? Okay, in addition to your 150 minutes of exercise, I want you guys to also try to incorporate 2 to 3 days of resistance training exercises. So, what is resistance? And how am I going to incorporate that? So it is super important to do weight bearing exercises with resistance. Now, resistance training can come in a lot of different forms. That can be using resistance bands, that can be using dumbbells, that could be using cables. There's a lot of different ways, or Pilates reformers. there's a lot of different ways to get resistance exercises, but it's super important to load your body in weight-bearing positions. Um, because this is where you're gonna really build muscular strength and help keep your bones strong. And this is really gonna help you mitigate the effects of chemo or radiation. So if you're having trouble figuring out kind of where to start with resistance exercises, it might be a good idea for you to see either a physical therapist, or there are actually, I know one physical therapist that also specializes in cancer related exercise that I'm happy to connect you guys with as well. So if you're a little bit lost on like where to get started with resistance training, then I definitely recommend meeting with a physical therapist or a personal trainer just to understand the movement patterns. And then you'll be able to more safely incorporate those things at home. And it is really important to do full body strength exercises. So a lot of times we get caught up in like things like just doing bicep curls or just doing triceps, but we want to do more functional full body movements. That being said, we want to do squats or sit to stands, deadlift movements, and lunges will be our main lower body movements. And then pushing movements like chest presses, push-ups, pulling movements like rows or lat pull downs, and then shoulder pressing. Those are going to be our main major movement patterns. Those are going to be multi-joint movements. So it's going to work more than just one area at a time. And those are going to be much more functional. That's going to be, putting a suitcase up overhead or picking up a laundry basket from the ground. Things that are going, might seem easy for you now, but as you go through treatment might be more difficult for you. What I'm going to show you guys is just a basic sit to stand, and so that you can incorporate some squatting into your practice to get you guys started with some resistance exercises. So what I want you to do, this is the opposite. Okay. I want you guys to find either the front of your chair. I'm gonna lower this down. And then you're gonna take a seat. I want your knees to be about 90 degrees. And then if you can, I want you to take your arms straight out in front of you. When I say go, I want you to try to stand up and sit down 5 times as fast but as safely as possible. Ready, set, and go. So you're gonna go 1 and down, 2, 3, 4, and 5. Then you're gonna sit down, 3, 2, 1. Good. Okay. If you were able to do that 5 times in the amount of time that I just allowed, that's a great starting point for you to incorporate. You can do those like 3 different times during the day, and that's going to be your 5 times sit to stand. If you just tried that little test and you were not able to stand up without pushing yourself off of the table, then this is an exercise that I want you to start working on using your hands to start, and then eventually trying to bring your arms out in front of you. If you were able to do that, but it took you longer than the time I allowed, I want you to start working on doing these a little bit faster. This test is called a 5 times sit to stand, and it is correlated with your fall risk. So if you are under 13 seconds, then you are having a decreased fall risk. Biggest thing right now is preventing falls, because your bodies are really fragile when you're going through treatment and afterwards, and we want to avoid fractures because that will complicate everything. We don't need that. So squats, most functional movement that you can do, easy thing that you can do in your chair at home. So I want you to try to incorporate those as part of your resistance exercises. Any questions on resistance training and how we can incorporate that? Okay, I'm gonna do one more little test with you guys for balance. And then I'm gonna have Nikki pop in and kind of talk to you guys about how she's incorporated resistance training and exercise into her treatment and week. So I'm gonna have you guys stand up one more time. And I want you to go someplace where you could rest your hands if you need to. So if you need your chair, anything like that, you can be here. What I'm gonna have you do, sorry, this is not the best view, but is pick up one foot just like this, and you're gonna try to balance when I say go. I'm gonna set a timer for 30 seconds, and I want you to see if you can balance on a single leg for 30 seconds. Ready, set, and go. If you're having trouble balancing, I want you to count how many times you tap your hand on the chair or have to stabilize yourself with your other foot. That's 15. 20. 3, 2, 1, and rest. Good. Okay, we're gonna do that same thing, but on the opposite side. So you're gonna switch feet and begin. So you're gonna test that. That's 10 seconds. Halfway. 20. 3, 2, 1, and rest. Good. Okay, so that 30-second single leg balance is a really good judge of how your balance is. And again, like I said at the beginning, neuropathy can really affect your balancing ability. So if you just had trouble balancing on one leg or the other, then it's really important for you to incorporate that exercise into your workout routine. A fun way, I don't know about fun, but an easy way to incorporate that is when you're brushing your teeth. Every 30 seconds, if you have like an electric toothbrush that switches, then switch your foot and try to balance while you're brushing your teeth. It's an easy way to work on your balance during something that you're already doing. So, 3 different components to your weekly exercise routine, just to review. Cardiovascular activity, 150 minutes is the goal. Resistance training, 2 to 3 times a week, working on full body movements, and then balance training to help mitigate any effects of neuropathy and prevent falls. Any questions of that before I have Nikki in here? Okay, so I brought Nikki in today because she has been a incredibly resilient woman during her treatment and during her whole journey. And she has been inside of our gym or with one of our physical therapists, working hard no matter what she's been going through. And even with different modifications that she's been put through, we've always been able to find ways that we can keep her exercising and keep her moving in a way that's kept her functional. So we've been fortunate enough to see her get just stronger and stronger each week. And even when she's dealt with challenges, then she has not given up and she's been very consistent in here when she can. So I'm going to welcome Nikki in, and she's going to give us a little bit of insight into how she incorporated exercise into her treatment journey here.
Hi, everyone. Nice to meet you. Yeah, so I, prior to being diagnosed with cancer, I was pretty active and had been working out with a trainer at Brittany's gym 2 to 3 times a week with resistance training, and was also walking probably at least an hour every day because I had a puppy at the time, a silver lab who needed a lot of exercise. Um, and so when I found out that I had stage 4 Hodgkin's lymphoma, my world kind of went upside down, and I started pretty quickly, pretty intensive every 2-week chemotherapy. And emotionally, it was a lot for me because I really lost exercise. I didn't know what I was going to be able to do. And also just from the standpoint of I was so reliant to going places to exercise. So having to worry about exercising with being around germs was always a concern as well, because that had always been a mainstay for me to keep me going. When I did start the treatment, I was able initially, because I think I was on steroids the first couple days of my chemo regimen, I was able to do a little bit more exercise, and that would look more like walking, kind of, I think you called it snacks. I was only able to do a little bit at a time. I actually, in the very beginning, went from being really strong to, I actually went into a wheelchair because I lost like so much strength. And I remember being at the hospital and I had to go from one end of Northwestern to the other. And I just like stopped and I was like, I can't do this. And it was a lot. So it's really hard with your body changing so much. I'm still emotional about it.
Okay.
Anyway, what I started to do was my friends would they would walk me like I was a dog. They would come to my house and they would walk with me just as far as I could go. So sometimes it would just be like from one side of the block to the other, and that was all I could do. It was fine. I was just happy to be moving. And then over time, I did get stronger. And I started incorporating, when my doctor said it was safe, more resistance training back with my trainer. And so we modified things so that instead of going for an hour, I would go for 30 minutes. And it did help tremendously. I think within like 2 weeks, like my walking improved because I was stronger, because I really did get pretty weak. And then we thought my cancer was gone, but 3 months after I was given the remission, it actually came back in a PET scan. And so then I was devastated because I had been working with my trainer again. We were up to, I think, 45 minutes at that point. And then I found out I had to have the full works of the second line of treatment, which involved a different chemotherapy, total body irradiation with radiation, and then I would be in the hospital for a whole month with a stem cell transplant. And it's actually coming up to a year anniversary on November 4th. Anyways, I approached it differently the second treatment, and I knew that I felt so much different with the exercise. And my doctor said as long as I wore a mask, I could go indoors. And so I stuck with it, and I told my trainer, like, I wanted to do it every day that I could. So we just timed it on how I was feeling when we kind of knew the cycle with my chemo, which days I, tended to have the most energy and which ones I was just done. I did develop neuropathy, actually during both treatments. But a couple times I lost my balance. A couple times when I was walking, I think I was in the hospital when that happened. And it's just when it happens, it kind of happens out of nowhere. And I think exercising helped me because it kept my body moving and made me aware of kind of the changes that I was going through. I could feel more versus just like sitting and withering away. Like I wasn't about that. So the second time when I was more dedicated to do the resistance training and going for walks, I was really methodical about the walks. My doctor at the time at Northwestern was like, even if you can only do a 10-minute walk, she said, try and double it that day. Or if you're doing it 3 times, she's like, all of that adds up. And it really did. And so I would literally like plan out my days around exercise. So I would go in and see my trainer 2 to 3 times a week. And then I would try and walk until I got to the point where one day my 3 kids, because they would always at night try and get me moving, they'd be like, Mom, do you know you've been walking for 35 minutes and you're actually going a little faster. I was pleasantly surprised. And so when I got out of the hospital for my transplant, obviously I did go through some loss of strength again, just because I was, laying in the hospital bed. But as soon as I was feeling perky enough, the doctors and nurses encouraged me to walk around the hospital floor, even though it was like just like 2 blocks, because it was very, very restricted because of germs. And I would just walk in my hospital gown and I would have my all my meds and I would just go and I would do that. And I think that kept me sane, because if I was just sitting in the hospital room, even if I was just sitting up or coloring or watching a show, I didn't feel alive. And so I think it made me really stay positive and alive, and it gave me something to look forward to. And then at the very end, when I, left after my transplant, I was really homebound for the first 3 months, but I still did what I could to, keep the resistance training going, and I'm still doing it. I was 46, almost 47 when I was diagnosed, and it pushed me into menopause. I have struggled a lot. I actually, when I was first diagnosed with cancer, lost a lot of weight. And then the second time when it started happening again, and I thought I was in the clear, I started losing weight again. So for me, it was the opposite. I ended up gaining weight because of all the steroids and because of pushing I guess my body into menopause. So now it's like, I know I need to do it, not just to make me feel good, but because of the hormone part. And so I hope that's helpful. I mean, movement just reminds me like I'm happy to be here, and it's so important for me to feel my best.
Thank you so much, Vicki.
Yeah.
And I can vouch for her. Today, she exercised for a full hour, only like minimal modifications because she still has a port, but there was so much that we can still do that she can do a full body, workout. With other women that are around her age that haven't gone through that, but there is so many things that she can do that we can focus on all of those, and we don't have to worry about the limitations. And something that I've talked to Nikki with about, and with all of my patients that have gone through this, is just take it one day at a time, and you have to meet your body where it's at. We can't compare to what we used to be able to do, or where our level of function was. Each day is going to be a new day. You don't know what the treatments are going to cause fatigue wise or pain wise on that day. And just obviously being alive is one thing, but knowing where your body is that day and what it's capable of doing, and kind of meeting your body where it's at, is so important. And like Nikki said, like you start at 10 minutes walking, or 1 block, and like then she was able to get to 35 minutes, and like that will continue to happen. And it's not going to be every day like that. Like you're going to have tough days, but on the days where you can push yourself, it's so important. And I've seen it come to life with Nikki. So thank you so much. I'm going to take you. And then this is also going to lead me into my next conversation, which is going to be about energy conservation techniques. Because again, like she said, breaking it up into like 10 minutes, like 3 times a day, and also considering what your chemo schedule is like, is super important, because you want to set yourself up for success here. You don't want to put a lot of pressure on yourself to have to, hit 45 minutes in a day. And if you don't hit that, you feel like you failed, because anything that you do is going to be a win. But let me discuss some energy conservation techniques that I utilize with my patients, because we're all women and we have a lot on our to-do list. And as we know, kids don't stop, like Vicky said, and also life doesn't stop, unfortunately. And you're gonna, there's gonna be other circumstances that are going through with you. So I want you to try to prioritize your day, because fatigue levels can go up and down. So if you know that in the mornings is when you have the most energy during your treatments, or afterwards, then you want to utilize your mornings. So maybe that's when you do your walking or your resistance exercises that takes up more of your energy. That's also the time of day where you're going to do like the highest level of priorities on your to-do list, whether that's your errands or your medical treatments. You want to do those things when you have the highest amount of energy. In the times where you slump, maybe that's the afternoon or the evenings, those are not the times to book your training appointments or your walks with your friends, because you know that your energy levels are going to be low. So you're going to be fighting your body with those. And that's going to be kind of a work in progress too. Like, again, like Nikki said, she knew on which days after chemo she would have the most energy. So those are the days that she's going to book her resistance exercises. On the other days, again, any movement that you can do or incorporate that can be beneficial is great. So be flexible with yourself. I know I'm very like type A and like need my whole schedule organized, but so put it into your calendar, but understand that you want to play around with it, and you can move things around to what adjustments make sense for your energy level and for your body during that time. The other thing is, again, finding a group or finding partner, a friend that can kind of help keep you accountable, but also help make this enjoyable. I know that I love exercise and I crave it and I need it for my mental health and sanity, but that's also my profession. So I know that for everybody, it's not always like that, especially at the beginning. Exercise can be kind of daunting and it can be fearful. You think that you might hurt yourself, or like it might be counteractive. So I think it's best that if you find somebody that you can walk with. I'm sure Nikki can account, like having somebody come over and walk with her made it more motivating. Um, whether that's your partner, your spouse, or a friend, setting up times to walk with other people can be really good socialization for you during a time that can be pretty lonely and stressful. Finding a group, either like a group exercise class. I know that Barb is still teaching with the Cancer Wellness Center, and there's some other classes that you can take. Those are great options. There's also a lot of virtual options, like the Peloton app that you can use on your phone that can provide different levels. So if you feel on a certain day where you're like, my energy is good, I feel like I can maybe do 20 minutes, you can adjust the filters to give you, 20-minute moderate exercise intensity. But if you're having a day where you're feeling fatigued and feeling low, then you can adjust that to a 10-minute class for, beginners. So using an app that you can do at home that you can kind of adjust and maybe will utilize your time better. That's another great option. Again, I really like the Peloton app. It's only $10 a month, even if you don't have the bike, because they do a lot of resistance training exercises. There's a lot of other apps out there that can be beneficial as well. And that way you can kind of adjust your schedule and it can be flexible. And or if you don't feel comfortable going into a gym, that could be another good option for you. The other thing with that is also finding a trainer or a physical therapist that you trust. So doing an evaluation with somebody and creating that plan of care. And I always say that my cancer patients, they always have a free pass of like, if you need to change your schedule and adjust anything like that. But find somebody that you can trust and that can advocate for you. I will obviously share my information with you guys. And even if you're not in the like Northfield or Glenview area and I can't be that person for you, I can try to connect you with somebody or connect you with one of the trainers that we have in our gym as well. So I know that you guys have a lot of advocates for you from the medical perspective and leading your cancer treatment, but it's also super important to have those team members kind of leading your exercise. And it's nice too to kind of just show up and not have to worry about what exercises you're doing and if you're doing things correctly. But if it's in your budget and if you can help support that, then it is great to have somebody kind of guide you through those things safely. Does anybody have any questions that they want to pop on? Any like specific questions that might be more related to your situation and your topic, anything like that? I'm not sure if Lisa wants to. Yes. Okay, Vicky said, did you discuss weights? So weights or weight training is going to go under resistance exercises, and I recommend trying to do full body resistance exercises 2 to 3 times a week. Again, those movement patterns are going to incorporate multi-joint exercises like squats, deadlifts, and lunges for your lower body, and then pushing, pulling, and pressing movements for your upper body. You can do a variation of dumbbells, kettlebells, cable machines, or if you have access to workout exercise machines, those are a great option as well. There's a lot of different varieties that you can utilize, but kind of finding whatever you have access to and then utilizing that is a great way to start. Again, with resistance exercises, if you haven't done a lot of them in the past and it feels intimidating to you, that's when I would recommend reaching out to a physical therapist or to a personal trainer to learn your proper form before getting into a good resistance exercise routine. The other option would be using an app like the Peloton app.
Do we have any other questions? Okay,
Awesome.
well, I think like Brittany said, she had sent me a handout and I will go ahead and send that out to everyone. Do you have any more to add, Brittany, after
I
questions?
think that covered everything from my
Yeah,
end.
perfect. Well, great. It was so nice to have everybody on. And Nikki, thank you so much for sharing your story. Really, that was really, really brave of you to come on and do that. So we really, truly appreciate that. So, Brittany, I want to thank you as well. And I love seeing you. And
Thank
we look
you.
forward to another program. Everybody keep your eyes on the calendar. Again, I will be sending you a follow-up email. And if you have any other questions, let me know. Otherwise, the email will have Brittany's information in there too if you're interested in getting in contact with her individually. All right, everyone. Well, have a great day. Enjoy this beautiful weather outside.
Yes. Get outside and walk and do your movement.
This is it. Get outside.
Get outside while you
All right,
can.
everyone. Thank you. Everyone
All
have a
right.
great
Thank you
day.
so much.
Bye-bye.